Hi everyone, welcome back to my channel. In today's video, we are going to talk about the things we may be doing unknowingly that is destroying our kidneys. These little organs don't get enough credit for what they do, and unfortunately we are doing things that is seriously damaging them. In this video, I'm going to unpack all of it for you. First things first, where exactly is our kidneys located? Our kidneys are two bean-shaped organs that is located on either side of spinal cord, just below the rib cage. Each kidney is about the size of our fist on either side, and they are responsible for filtering the blood. They filter about 142 liters of blood a day. That's about filtering your whole volume of blood 30 times. Now, let's talk about what these powerhouses do. Their first major function is to filter waste and excess fluid. It takes all the good stuff and then excretes the toxins and waste materials in the form of urine out of the body. The second major function of the kidney is balancing electrolytes. Electrolytes consist of sodium, potassium, calcium, magnesium, and the others. So they balance it out in the body because the body has to be in a state of homeostasis, balance. Homeostasis generally means balance. The third major function of the kidney is also to regulate your blood pressure. It regulates the amount of fluid we have in our bodies, that is either excreting when we have more and all, or retaining when we have less fluid in our body. The kidneys also produces hormones that helps in the body function. So it produces erythropoietin that helps in the production of red blood cells. The kidneys also keep our bones and our teeth strong by regulating the amount of calcium and phosphorus in our body, keeping it in check. They also produce the calcitriol hormones by activating vitamin D to keep the teeth and the bones strong. In short, our kidneys are responsible for keeping everything in our body running smoothly. So what happens if the kidney fails? Unfortunately, kidney disease is often referred to as the silent killer because the symptoms are subtle, and before you realize you are in chronic kidney failure or moving towards end-stage renal disease. So here are some signs to watch out for. The first sign is fatigue and weakness even after a good night's sleep. This is because of the buildup of toxins in the body that leads to your body feeling weak and fatigued and unable to concentrate. The next one is swelling of the legs, ankles, and feet. This happens because there's retention of sodium in the body when the kidney fails, and then sodium attracts water, which causes your feet to swell. There's also changes in urination. The first change you see is foamy urine, where there's a seep of protein into your urine, which is not supposed to be so. The filter of the kidney is supposed to filter out all the proteins, but once they start getting into the urine, it becomes foamy, and that's a problem. The next change in your urine is needing to pee more. This happens because the disorder decreases the amount of fluid reabsorbed by the kidneys. The next symptom is shortness of breath. This happens when there's fluid accumulation in the lungs called pulmonary edema, which reduces the exchange of gases in your lungs and then causes shortness of breath. There's also the symptom of persistent itching. This is as a result of deposits of urea, which is supposed to be excreted by the kidneys. When they are not excreted, they build up in the blood and then they are deposited on the skin as white patches, and this is very itchy and uncomfortable. There's also the symptom of trouble sleeping due to buildup of toxins in the body. Another symptom is blood in the urine, which is due to the leak of red blood cells through the damaged filter, so blood cells, protein, and big molecules are able to pass through. There's also puffiness around the eye due to loss of protein. When protein is lost, it causes the body to swell up. If you notice this symptom, it is crucial and very important you report to a hospital or a healthcare provider to be treated as soon as possible. The first complication is heart diseases. This is because the heart has to work in overdrive to increase the blood supply to the kidneys. The next complication is anemia. Anemia because the kidneys are damaged and they are not able to produce adequate erythropoietin for the production of red blood cells. Other complications are bone diseases, high blood pressure, fluid overload, and erectile dysfunction. Many kidney disease patients have very narrow arteries, which leads to less blood supply to the penis, hence the complication of erectile dysfunction. As you can see, it's like a domino effect, and you don't want it to get to this point at all. It's not pleasant. Now let's get to why we are all here, how you are destroying your kidneys without even knowing it. Here are some common habits that can cause serious damage. Overuse of painkillers. Painkillers such as NSAIDs. Examples of those are diclofenac, naproxen, naproxen, ibuprofen, they are nephrotoxic, meaning they are toxic to the kidneys. When they are overused or abused, they can cause damage to the kidney. The next one is eating too much salt. Too much salt causes the kidneys to work hard and also increases the blood pressure, giving the kidney too much work and also damaging the kidney in the process. Not drinking enough water. Dehydration has been known to cause kidney disease. Even the mildest form of dehydration over time can cause permanent damage to the kidney. Dehydration also causes a buildup of waste and acids in the body, which causes the kidneys to be clogged with myoglobin, which is muscle proteins, which damage the kidneys. The next one is eating too much sugar. Now, too much sugar can cause kidney disease. When your sugar level goes above 11 grams per deciliter, kidney starts spilling sugar out of the urine, which is not supposed to be so. Once this happens, it damages the filter of the kidneys, which leads to kidney disease. When you don't have diabetes, it's normally not a problem because your body is able to compensate. But those with diabetes should really watch out for this and not let their sugar goes above certain levels prescribed by their doctors. Holding in urine is another thing we are doing that's destroying our kidneys. This happens because when you hold in urine in your bladder, it leads to infections that causes harm to your kidneys. The other thing is that when you hold urine in your bladder, it causes metabolic abnormalities and electrolyte issues that also damage your kidneys. Excessive intake of red meat. Research has shown that excessive intake of red meat increases your risk of getting chronic kidney disease by 72%. When you eat excessive red meat, albuminuria occurs, which is essentially filter of your kidneys breaking down and then protein leaking into your urine, and eventually progressively leads to chronic kidney disease. The next thing we are doing to destroy our kidneys is ignoring diabetes and then high blood pressure. These are the two main conditions that causes kidney damage. What I've realized in my practice of late is that men especially don't like taking their blood pressure medications because it causes erectile dysfunction. I would urge you, if you are watching me, to please take your blood pressure medication. There are newer blood pressure medications now that do not cause the erectile dysfunction. There are some that causes the erectile dysfunction that may be prescribed for you in the acute phases of your high blood pressure. Now, when it's under control, there are newer medications that can be given that do not have those effects. But outrightly stopping your blood pressure medication leads to certain complications, like aside from kidney disease, it causes stroke and sudden death in certain instances. If you don't take anything from this video, please take your blood pressure medications. Go to your doctor until you find a drug that works for you, that do not have those unpleasant side effects. And the irony of the whole thing is that you are not taking your BP medications because it's going to cause erectile dysfunction. Now you end up getting kidney disease. That function is even non-existent at all. So please, in my practice as a nurse, I realized that a lot of young people were coming in with kidney disease. Most of them were relatively young and below the age of 40. So when I decided to do my MPhil nursing, my topic of choice was quality of life of young adults with chronic kidney disease. And I was amazed by my findings. A lot of young adults were doing some of these things that were causing the kidney disease, not taking their BP medications, abusing nephrotoxic drug pain medications, taking herbal medications that are not FDA approved and abusing them, and also not taking diabetes seriously and treating it. In my interviews, I came across very sad stories. There was a nurse that was trying to conceive for 2 years and was unsuccessful. She went to the hospital for a series of lab tests, and then on her way back home decided to go to these herbal vendors and then get some concoctions to take. After 2 months of taking these herbal medications, she came back in end-stage renal disease. She came back, her kidneys completely destroyed. Because she did tests shortly before she started herbal medications, you could compare her labs before taking the herbal medications and the labs after, and then you could now link it directly to her taking the herbal medication. Some men were also not taking their BP medications. Another long-distance driver, a 30-year-old, also abused pain medications for over 10 years, which led to him getting chronic kidney disease, and his life has just changed for the worse. Because treatment of kidney disease is not cheap. You could spend in excess of 7,000 to 10,000 Ghana cedis every month on just dialysis medications, and sometimes blood. In addition to that, you have various symptoms like weakness, fatigue, swelling, pulmonary edema, coming into the hospitals over and over again for admission for one complication or the other. So please take care of your kidneys. This is not to scare you, but to let you have the clear picture of what the situation is on the ground, so that you take your kidney health or your health in general seriously. Because nowadays I realize we do a lot of things that are hurting us and we are carefree about it because nothing has propped up yet. Most of these chronic diseases are very silent. They creep up on you in the most unexpected way and kind of changes your whole life trajectory to the worst. Now let's talk about the things we can do to keep our kidneys healthy. Stay hydrated. You have to aim to at least drink 6 to 8 glasses of water a day. I carry this bottle, I don't know if you could see it. I carry this bottle along everywhere I go, and it reminds me to drink water at every time. Once you don't have anything to remind you, it becomes difficult. The days I do not carry my bottle, I realize I don't drink enough water. If you cannot carry this big bottle, you can even get 1 liter bottles and then aim to drink at least 2 of those, and then that should be good for you for the day. Now eat balanced diet. We have to focus on fruits and vegetables. Eat lean protein, whole grains, and then reduce salt and sugar as much as possible. Try to do regular checkups to monitor your blood pressure and blood sugars. Catch some of these disease conditions early. Once diagnosed early, it's very easy to treat. But when they linger for a long time, they tend to affect other organs, then it becomes more complicated and cumbersome to treat. Other tips include regular exercise, stopping smoking, and then reducing alcohol and then caffeine intake. By making these small changes, you are giving your kidney the best chance to stay healthy and doing their jobs they are supposed to do. Your kidneys might be small, but they play a huge role in keeping you healthy. If you have any topics or questions you would like me to cover, please drop them in the comment section. I'll make sure to read them. I'd love to hear from you. Thank you so much for watching.